In this video, I will discuss how to use Piracetam. Piracetam has over 30 years of clinical use, and more than 800 studies have been published on it. The way to use it is extremely clear. Unfortunately, too many opinions have muddied the clinical facts. I will dispel these and lay out a clear path for you to get the most out of Piracetam. Using Piracetam is very simple. You just take your predetermined number of tablets and drink them with a full glass of water on an empty stomach. Piracetam is soluble in water and is not metabolized within the body to any other substance. This means that unlike other drugs, Piracetam has no negative effect on the liver. In fact, it has no direct effect on the liver. It passes right through. When orally administered, 99% of Piracetam is absorbed directly into the blood. Piracetam can be used by injection, but the only reason to do this would be if the patient's intestinal lining is irritated. Following ingestion, Piracetam hits peak plasma levels in 1.5 hours. From the blood, it readily crosses the blood-brain barrier. Piracetam is completely excreted via urine. Piracetam is very bitter, and so it is most commonly found in the form of tablets. Absorption is faster if the tablets are not enterically coated, or if you use capsules or powder. I prefer non-coated tablets of 400 milligrams because this is a good trade-off between speed of absorption and bitterness. The half-life of Piracetam in the blood is 5 hours. This means 3 to 4 doses of Piracetam per day are ideal. The dosages typically vary between 1.6 and 9.6 grams per day, depending on the reason Piracetam is used for. This means 4 to 24 400 milligram tablets per day divided in 3 or 4 doses. I will discuss dosing in more detail in the video Piracetam dosages. You can typically increase your Piracetam dosage however much you like, because there is no toxicity and no impact on any organ. However, pay careful attention to synergies and interactions, as you may be able to reduce dosages and still get impressive benefits. The best way to use Piracetam is to set up a daily schedule and use the same dosages at the same times each day. An example schedule is 4 tablets at 8 a.m., 4 tablets at 12 p.m., and 4 tablets at 5 p.m. Again, the schedule and dosages may be altered depending on the condition. For example, if using it for treatment, for work, or for study. Please remember that Piracetam can negatively interact with food additives such as monosodium glutamate, MSG, and aspartame. This means it is better to use Piracetam on an empty stomach, or at least 3 hours after your last meal. Sometimes an attack dose of 4 to 8 grams for the first 3 days is recommended. A particular subset of people will not notice any immediate effects when starting to take Piracetam, and this is where the attack dose idea came from. I do not favor this because of potential intestinal irritation and the fact that the Piracetam will just flush through your system, mostly being wasted. In summary, use Piracetam on an empty stomach with plenty of water and at the same times each day. Remember that Piracetam has a short half-life and consistency of use is key for maximum benefits. Set up a daily schedule and follow through. In this video you have learned how to use Piracetam. If you want to learn more useful things about Piracetam, then go to damianalexander.com/PiracetamPDF. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourOwnbatteries.com.